Hello, David Fitzgerald here from Dublin Physiotherapy Clinic here again. Today I'd like to talk about fitness to work. A lot of interest in recent times about the costs of both indirect and direct of people being off work due to musculoskeletal disorders, sometimes known as MSDs, not to be confused with STDs. Musculoskeletal disorders in relation to work-related problems usually involve upper limb pain, so sometimes referred to as repetitive strain injury, but it can also typically involve back and neck problems as well. Now, in general, there is a broad degree of severity of problems that can occur in each of these areas. So, from a clinician's point of view, what we're really trying to do is identify early people who are getting symptoms in relation to either activities at work or certain work practices that may be overstressing their system and producing symptoms. There are really two areas to focus on. One is what's called ergonomics, so that's really looking at the ergonomics of how a particular task is done. Is it being done efficiently? Is the proper equipment being used? People will be aware of this with workstation assessment, where one looks to see if the actual seating and desk and computer arrangement is suitable. Of course, nowadays with many people working on laptops and using a laptop as a desktop replacement, it's actually quite hard to be in an ergonomically good position. So that certainly does predispose to lots of increased areas of pressure and aches and pains. So the ergonomic aspect of work arrangement is one big area where attention needs to be focused. And then the second huge area, which is your own individual conditioning. And very often poor musculoskeletal conditioning predisposes people to develop problems, which is why some people in one work scenario will develop symptoms and others won't. So this is actually a huge area which requires specific attention in terms of evaluating your musculoskeletal health, observing and looking for flexibility deficits, postural alignment deficits, muscle control problems, and general physical conditioning. And obviously these factors will profoundly influence whether you're susceptible to aches and pains at work or having more serious problems. So the general management is twofold: looking at the internal issues of job structure and task, and then secondly, and in my view more importantly, looking at why people are developing symptoms in terms of where their own musculoskeletal weaknesses is, and then really going about implementing a program to try to address this. This, of course, is what physiotherapists do on a day-to-day basis. This is our area of expertise, and it's really important not just to treat symptoms, but actually try to find the root cause of what's causing the onset of symptoms. So, if you'd like any more information, feel free to call us here on Dublin Physiotherapy Clinic, 8829 174. Look forward to speaking to you then. Bye for now.